Forward, I would also like to take a moment to acknowledge the land and the ancestors. Personally, I am of Afro-Caribbean descent, and so I think it's important for me to recognize that the reason for which I am standing here before you today is due to the resilience and strength and rebellion of my ancestors, many of whom were forcefully displaced during the transatlantic slave trade. You know, we have gathered here today for Black History Month, but I would really encourage you all to continue to have these conversations year-round. Black people continue being Black year-round. We need to continue to speak about the challenges, the historical horrors, and contemporary impacts every day, and not only for Black History Month. So I encourage you all to continue to attend Black-led events, continue supporting your communities and advocating in any way you know how. I also have to acknowledge that the same transatlantic slave trade that enslaved my ancestors also exploited indigenous people, and ultimately leading to me occupying unceded territory known as Jojage, or otherwise known as Montreal. And so I think we also have to continue to reflect on the horrors and injustices that indigenous communities face and continue to face in today's world, how it has continued to impact their communities, and how we might be perpetuating settler colonialism in our everyday activities. So I'm giving you all two things to work on after this presentation. One, continue talking about Black history, Black accomplishments, and Black successes. Also continue to reflect and think on in the indigenous, the horrors that indigenous communities face and continue to face, and how we can work alongside these communities to ensure that they have equitable treatments in their everyday lives. Next, for a few community guidelines. The first one is to just center respect and dignity. And these community guidelines are put in place to ensure a safer space for everybody, to ensure everybody feels comfortable speaking, learning, sharing things, or any thoughts they might have. So first, please center respect and dignity. Treat all participants with respect, regardless of race, gender, sexuality, religion, ability, or background. Second, honor lived experiences. Please do not question, invalidate, or demand proof of someone's experiences with racism or discrimination. Lived experiences is a form of expertise. Third, we won't tolerate any harmful language or behaviors. So that includes, for example, discriminatory language, harassment, or intimidation. Fourth, please care for yourself and others. We might be addressing some more sensitive topics in this presentation. And it might be triggering to some or perhaps cause some discomfort to others. So if you need a moment to yourselves, please feel free to step out of the room or away from your Zoom and to come back when you're ready. Finally, please feel free to ask questions. As you just heard from our speaker, she loves engagement. So if at any point you have a question in the presentation, whether in person or on Zoom, please feel free to ask, share what you know, and let's support and learn from each other. So with that being said, I will ask the EDI committee's I will ask the EDI committee's chair to please come and introduce Dr. Myrna Lashley.
Hello, everyone. Good afternoon. My name is Cheryl Bethany, Program Manager of Graduate and Research, and I'm also the chair of EDI. It gives me great pleasure to introduce Dr. Myrna Lashley, one of Canada's leading voices in cultural psychology, mental health, and community equity. She's an associate professor in the Department of Psychiatry here at McGill and a researcher at the Lady Davis Institute of Jewish General Hospital, where her work explores the intersections of culture, geopsychiatry, and mental health. Dr. Lashley is a sought-after consultant, having supported First Nations, Jewish communities, and the Brazilian healthcare system. She has also served on multiple expert committees addressing racial profiling, intercultural relations, and systemic discrimination. Her outstanding contributions have earned her numerous honors, including being named a member of the Order of Canada, the Queen Elizabeth II Diamond Jubilee Medal, and the Martin Luther King Legacy Award. In Dr. Lashley's work, she shines a light on the powerful ways systemic racism, unconscious bias, and intergenerational trauma shape the mental health experiences of Black communities. She challenges us to look beyond individuals and examine the structures, assumptions, and histories that influence how people are seen and treated. Her message emphasizes the importance of true allyship, recognizing our own biases, engaging actively in equity, and creating environments where people feel generally safe and respected. She reminds us that resilience is not just an individual trait, but something nurtured within supportive, equitable systems. Today, Dr. Lashley invites us to rethink how we understand mental health, to acknowledge the realities of structural racism, and to work intentionally toward creating systems that heal rather than harm. Please join me in giving a warm welcome to Dr. Myrna Lashley.
Very, very, very much. That was extraordinarily kind of you. And every time I hear these things, I say, who are they talking about? So the first thing I want to tell you, I want you to turn and look at whoever's sitting next to you. Just look at them. Just look at them. Just look at them. I'm not asking you to do anything else. And I want you to internalize what this is. Look at it. Why are you staring at me? What do you see? Think about what you see when you look at each other. You just met each other on the street. What's coming through your mind? Something is. We make decisions like that. Walking down the street, somebody's walking towards you. You look at their coat. Somebody gets on the bus, sit next to you. How do you choose? How do you know when you're walking down the street that you should smile at some people and not smile at others? These are split decisions that we make. Now, I want to tell you something that you may never have heard before. Everyone in this room is white. Yeah. I've got her looking at me and I say, what? Everyone in this room is white. Reason is because we all live in whiteness. Every one of us. What we teach, how we teach it, we live in whiteness. It's not about white people. So when you look at each other, you're not looking at white people. You don't even know what that means. You don't know what black people mean, what white people, we don't know what that means. But we know what whiteness is. So when I talk today, I'm not attacking white people. I have no interest in attacking white people. It's a waste of time. Just causes divisions. That's not what we're talking about. But we are talking about whiteness. And as we go through this, I hope that I make it clear what we're talking about. We are talking, folks, about whiteness. We're talking about systemic racism, systemic discrimination. Let's get the definition that we're working. I mean, there's a lot of them out there. But the one that we're talking about, I got to keep looking for cameras. Apparently, I have a minimum amount of space for moving here. Okay, so systemic, we're using the Bonilla Silva's definition. And it's that systemic and structural racism are forms, see the S? Forms of racism that are pervasive and deeply embedded in and throughout systems, laws, written and unwritten policies, entrenched practices, established beliefs and attitudes, and they produce and they go on to condone and perpetuate widespread unfair treatment of people of color. Folks, we're talking about whiteness, not white people. can't, this dichotomy. Sit down, please. It's okay. Just sit down there. Sit down. It's all good. It's all good. No, it's all good. It's all good. We're not talking about pigmentation. We're not looking at people and saying, you're a this or you're a that, because we are all suffering under the same banalities of whiteness. All of us. Nobody's free of it in here. If you're living a life where you think you're better than other people, you're suffering under whiteness. If you're living a life where you've been taught that you're not as good as other people, you're suffering under whiteness, not white people. And that's important to understand. It's very easy to fall into the trap of, oh, white people they are doing this. But white people, black people, pink people, blue people, gay people, straight people, it all comes out of this same systemic issue. And that's why we need to understand that privilege is not the shark. It's the water. It's the water, it's not the shark. The shark is doing what sharks do. Or what sharks have been trained to do. What mother shark, daddy shark, taught baby shark to do. So we can't change but we can change the water. When we change the water, we change behaviors. Warm up that water a little bit, that shark's gonna do a little thing. Cold, make the water a little bit colder, shark's gonna turn like this. It's not the shark. It's the water. It's about whiteness. It's not about white people. So change the water. What did Martin Luther King say? He said, we must recognize that justice for Black people cannot be achieved without radical changes in the structure of our society. Change the water. It is not the shark. Go ahead. Yeah, go ahead, sure.
I mean, I think it's a very powerful message. I've heard it's in a different context as well of two fish in a fish tank saying,
Mm-hmm.
the water's nice today. That one's like, what is water? Because we're so used to the structures around us that we forget to pay attention.
That's right. It's the water. It's not the shark. Anybody else before I move on? Build up your courage because I'm coming for you. Okay. We're going to do a case study. Because that's the best way to explain these things. Now, this is word for word true. Case studies we usually create from fragments so that we can protect the identity of others. This lady published this herself. So there was no need for, yes.
There's a comment in the chat asking, how do we change the water?
We're going there. Tell that person that just by being here, they started to change the water. This is a 31-year-old. Now, she is a Black American. She's cisgendered. She's a first-generation college student. She's a psychoanalyst. The question is she really one of us? That's the question she asked. She said, I'm a psychoanalyst. I'm all these other things. Am I really one of you? The question here is, how do we make people coming into our system feel that they're one of us? Do we continue being the shark? Or do we look at the water? And that's the question she's asking. She was born into a working class family. So right there, we know she's carrying a weight on her shoulder. She's born into, and her family, they're the descendants of slaves. She's the first person to finish college. She's carrying a weight. Now, in 2019, the Ghanaian government said, let's have the year of the return. And what was meant by the year of return? It's the time for the diaspora to return home. I'm tired talking. Somebody say something.
We heard about it, yeah.
Pardon? Okay, you heard about the movie, but
The pandemic, that's when we heard more.
yeah, that's where it started. Okay, but what else? We've heard of it, but what is it saying? It's saying more than that. What do we hear it? What are we being told? Yes.
I think people can claim citizenship
Mhm.
through ancestry, and not only Ghana, it's Vietnam, see.
But why is that important? What's the big deal? Yes.
Access back to your roots and learning about yourself beyond just, for example, if you're an African American, you might have lost that connection to understanding who you are and your family. So it's to reconnect, I think.
It's a rootedness, which is the same thing we talk about when we talk about indigenous people. They talk about their roots. When Jewish people talk about going to Israel. Now, this is the same thing that Ghana has done for all Black people. They've said, come home. Because yes, sir.
So is it implicitly saying you are not at home in the diaspora?
Well, that's a really good question. Am I still within range here? Can I move?
Now you can move everywhere.
Oh, good. Everywhere is good. Okay, that's a really important question. Are you not at home where you are? Now that has to do with what we do with the water, doesn't it? That has to do with what we do with water. Now, but above and beyond that, one of the things we have to bear in mind is that for these folks from the diaspora, most, not the ones who were born in Africa and deliberately say they're moving here now or comes, across the swell. These are people who were transported. That transportation meant that you lost your roots, you lost your home, you lost your language, you lost your religion. You know why I speak English? Because whiteness speaks English. But I don't know what my language is. And what's happening is they're saying, we know you've lost these things, but come where you can get some semblance of it. You won't find your family. You won't know what your clan is. You won't know what your tribe is. But at least you'll be on a continent, in a country that where the gate of no return, one of the gates of no return was in Ghana. And at least you come back here and maybe you'll get a feeling. And we're going to discuss that in a few seconds. But it's a really important question. Am I here? The same thing she was saying. Am I one of you? Do I belong? And that comes back to what do we do with the water? What do we do with that? How do we do the water? So it's 2019, and she did what a lot of people do. She said, I'm going to go there. And look, let's take a look. If I go in the back, am I still being? Okay. So what did she say? She said, when I found myself crying, I could appreciate that I was experiencing pain. When I found myself angry with whiteness, Europeans, my colonizers, I could make space for my hurt. When I witnessed aggression directed to the only white man who participated in my tour group, I could appreciate the projections, displacements, and enactments that manifest when unspoken pain remains unspoken for too long, or for when the assault of history is displaced on and distilled into the individual versus the structural. Somebody give me a breakdown. What's this young lady saying? Talk to me. Okay, Yvonne, tell me. You've looked at me. That's a bid. I accept the bid. Go ahead, tell me.
Interesting to see how pain is part of this whole journey, and part of the way in which we deal with the waters, it's how to release that pain and how to find a way to heal, as you said before.
Encore plus, there's more in there, but thank you. Yes, you're absolutely right. Sorry, yes, go ahead.
There's a sense of self-awareness. She's 31.
Yes.
Already she's able to assess her own reality in all of it, which I find that at least for a lot of folks in the Black community, or maybe externally, don't necessarily have the tools, the words to put something. You know that you felt a certain way, but there's so much that she's assessing. So it's I find it somewhat impressive at 31 to have that maturity that a lot of even older adults don't have.
And she doesn't get it till she goes to Africa.
Mm.
Let's focus in on this bit where she said, I could make space for my hurt. She says, when I witness aggression, because these are tours. When you go, you sign up for tours. You go to, anybody can go on the tour. When I witnessed aggression toward the only white man who participated in my tour, I could appreciate the projections, displacements, and enactments that manifest when unspoken pain remains unspoken for too long, or for when the assault of history is displaced on and distilled into the individual versus the structural. What's she telling us? What's going on here? Yeah.
I think part of what she's saying is that she wasn't given her life had given her too many opportunities to be angry at the shark and not enough opportunities to kind of process it in a way that would get her to understand that it is the water that is the problem, as you said.
Yes, but she says more than that. She says, go ahead.
She's witnessing people in her group taking out their aggression on the shark.
Yes.
And she's understanding why that's happening. She can appreciate the projections, displacements, and enactments that cause that to happen. But she's also kind of like Kate said, understanding it's actually more than that.
Yes. Yeah, because she's understanding. It's a combination of what you said. She's never been able to do this. And she's looking at that and she's not liking it. But she says, but I understand. And by extension, I understand his pain. Now, we don't know who this man is. You know, maybe this man is an ally. I assume he is because he's here. I don't know. You know, maybe he's an ally. Maybe he's got Black kids. Maybe his wife or his partner is Black. We don't know. But what do we see? We're walking down the street. Remember when I asked you to look at each other? And we make a decision. We make an assessment. He must be the shark. And she said, I don't like it, but I understand. And we go through this every day. Every day. It's easy when something happens for us to displace it onto someone and say, you're the problem. And maybe you are the manifestation of the problem, but it's the bleeding water. We gotta change the water. So let's see what else. She said she goes through psychoanalysis and it helps her to understand. Yes, you got something? She said the impact of being able to openly acknowledge colonialism, slavery, and trauma. The impact of fantasizing, and this is important, we're going to talk about this. The impact of fantasizing about an alternate history where colonizers never touched the soil of West Africa in the late 1500s. A fantasy that the African part of my African-American identity was not haunted by the legacy of slavery, where I knew which countries my ancestors came from, what tribes they belonged to, what customs and traditions they practiced, and the reality of the major disruptions in my genealogy and subsequent grief of that reality. Psychoanalysis helped her to understand that. What is she telling us? Go ahead.
Now I'm looking at you.
Yes.
This to me is very important because it's part of the discussion that I usually have, and it's quite different because I come from a different context.
Yes.
I come from a country in which we don't have Black communities, white communities and indigenous communities,
Mhm.
but we have communities that have blended themselves.
Where are you from?
From Colombia.
Colombia.
So we have, if someone have heard of cumbia,
Mhm.
very famous type of music in
Yeah.
South America.
Yeah.
That comes from drums from Africa and flutes from the indigenous groups, who basically merged and created a new culture and a new, so yes, it's a terrible history, but it's also the way in which something beautiful have emerged
Mhm.
and something that has a lot of potential has emerged. So I think that it's a nice way to also approach this terrible history
Mhm.
and focus on something that is building a positive path, if you want, or a possibility.
You've done a better job in Colombia than done in Brazil, I'll tell you that. But thank you for that. You're absolutely right. But it goes beyond that. Let's talk about the fantasy. Tell me about the fantasy. Yes, ma'am.
I know it makes me think about I appreciate this idea around fantasy and alternative world building. You know, it makes me think about like I don't know if people have been to see the Kent Monkman exhibit, but that's at the Musée des Beaux-Arts right now. There's this really beautiful, like stunning exhibit. It's not about a reality of no contact between colonizers, but it's a totally alternative reality of what could have been, or a different way of seeing or understanding what happened in contact or what happened in colonialism. And it's so beautiful and moving, like the idea of living in that fantasy. And it makes me think about like Wakanda and like, you know, a different world of like, you know, powerful, you know, Black excellence that could be or could have been, or, you know, that is lost, but the fantasy is powerful and important.
Yeah.
You know, to hold that.
To hold on to that. Oh, absolutely true. She said more than that.
Yeah, let's go. Somebody else take it.
It's more than that. That's you're both absolutely. You're telling me about the water, how the water was changed. You're saying about holding that alternative thing in your hand and what that does. She goes beyond that. Let's dig it out. Let's dig at it. Yes.
For me, it talks about freedom, to be free to think about alternative, to be free to revisit the past, to be free to say, if the colonizer didn't come to Africa, and what would be our current history, and what will be the roots that we would like to carry on to the present, now.
Yes, okay.
She's saying,
what would, it helps her to understand the impact of having, that's where we're missing here, of having to do the fantasy. Because the fantasy is a survival tactic. Yes.
There's a question or comment on Zoom.
Yeah.
Alex Zerbo, if you want to unmute yourself to speak.
Yes, thank you so much. This is such a wonderful discussion, and I'm happy as online attendees we can contribute as well. I love what you just said, and in her statement, I'm also seeing a bit of grief of grieving something that's been taken forcefully from her, and also mixed with the trauma of what she's left with.
Absolutely.
Yeah.
Thank you so much for that intervention. Is there anything else you want to add?
No, thank you so much.
I thank you. Go ahead.
Someone in the chat said an important reminder of lessons in art and its power to teach and inspire.
Okay, thank you. I need that person to elucidate because I don't know where they're going with that. Could you ask them to go a little bit further, please?
Devon Simpson, would you like to unmute to elaborate on your comment?
I'm trying. Hi.
Hi.
Hi, thank you so much. I was just thinking about the power of art and the way that art invites sort of like a somatic, experiential learning and reflection, and the importance of this of learning and unlearning happening both in like academy and in research and in history and in the power of that, and also in art and music and the feelings that that brings to us. And so when Leah was sharing about Kent Monkman's work, it just reminded me that this is just such a powerful way to learn and unlearn and inspire
So
and
you're seeing art as an instrument of healing.
of healing and of change. And I think building on what the previous speaker was sharing, that trauma-informed work is grief work and
Yes.
is that is part of the healing, and we can't do that, I think, outside of art and culture. And earlier I had, when before your incredible introduction, I had put in the chat, like, I'd love to know the relationship between opera and jazz, right? Like, it's in all of these spaces where I think there's just such beauty and such a gift of learning.
Well, the thing about the relationship is that when your voice hits the point where you are no longer singing opera, you can redirect your register to a lower resonance, and you can sing some jazz. But it's true.
Beautiful. Thank you.
Yeah.
There's two more comments. Jason Hansen said, the fantasy allows us to envision a new structure, how to change the water.
Yeah.
And then Allison Saunders said, it's very fitting that Kent Monkman's exhibit is called History. It's painted by the victors. It's wonderful to see other voices represented in history this way.
Absolutely. Thank you for those. I don't want you to ignore this part where she said, helped her to understand. You don't focus on this without looking at that. We're running into a thing where we're just looking at this as opposed, and without including the antecedent, which she said it helped her to understand the impact of being able to openly acknowledge these things, help her understand the impact of fantasizing about an alternative history. What she's saying here, and especially when she gets to the point of a fantasy, that the African part of my African American identity, what would it be not to be haunted by that? She's had this fantasy. What would it be to be white? What would it be to be part of the conqueror, to be part of the dominant group? What if I was not haunted by this legacy? What if I knew where my family came from? What if I knew where I belong? What if I knew what my customs and traditions were? These are the fantasies that people create when they've been displaced, when there is nothing there. Indigenous people do it all the time. You know, gay people do it all the time when they're confronted with the anger and the stupid hatred of heterosexuality. Say, what if? It's a what if question. What if? And she said, going through psychoanalysis, it helped her to understand why she was living in this what if world. What if things were different? What if the water wasn't what the water is? Colombia addressed part of it. You did. Not all of it, but you addressed part of it. There's still some problems in Colombia. We know that. But they did a better job than Brazil. And Argentina, the way they did it, just wiped out all the black people and said they were never here. But she said, what if? And it helped her, going through that process, helped her to understand why she was living in a what if world. And she was living in a what if world because the real world in which she was living was so painful. She said, yet And I want you, as you're in family medicine, you've got people coming in. I want you to substitute the word psychoanalytic community for whatever community, professional community you're in. If it's art therapy, if it's psychology, if it's psychoanalysis, if it's whatever it is. Yet it is difficult to share my experience within the fill in the blank, whatever you're in, because in short, it is a risk. I am availing vulnerable parts to a community that remains largely unawake. I agree with Slevin and Stout that psychoanalysis has failed to meet the challenges of race and racism. There are too few Black analysts, too few Black patients, too little psychoanalytic understanding of Black communities and Black patients. Little attention has been paid to issues of race in the analyses of white patients. Until the neglect of race and racism is centered, discussions such as these will remain difficult. Voices such as mine will remain silenced, and healing will remain stifled. I think the bottom part, is probably so, but let's talk about, it is difficult to share my experience within the X community because it is a risk. Go ahead. Yeah. You bid. Yeah, you bid. Yeah, what are you thinking?
So I was thinking that probably she is thinking that what pain she endured is her strength to fight back.
Is her strength to fight back? Yeah. That's part of it. But she says it is a risk. It is a risk to share my experience because it is a risk.
Yeah.
Yes, sir.
I think the risk is the notion of being stigmatized. The second that you're able to have the fear of the labeling. Mm-hmm. Once you have it, you're exposed. And I think she's battling with the idea of being exposed.
Yeah. Fear of rejection. Fear of rejection. Yeah.
And also, fear of rejection by her professional community.
Yes. What does the question she asked at the beginning? Do you remember what the first question she asked? Am I really? Remember that? Am I really? So it is a risk to say, this is the pain I'm feeling. When that patient said they didn't want me because I'm Black, or how do I tell you if I don't know that I'm safe, if I don't know that I'm in good water here? How do I know you're going to say to me, it's all in your head, or you've got a chip on your shoulder? Oh, well, go somewhere else. Go get your own damn boat. How she's saying this is a risk. So the question is, what are we in our professions when we have people coming in who may not fit the so-called norm? How are we making space? And I hate it when people say, well, we've got our quota, there's no more room. If the table is small, well, use your elbows, build a bloody damn bigger table. Don't tell me there's no room at the table. Build a bigger table. So what are we doing? Are we holding on to our little bit of the world and saying, it's mine? What are we doing? She said, lastly, I share my experience of pain navigating the spaces with my intersecting identities. Because we all have intersected. And she told you what some of hers were. Afro-American, first person to go to university, psychoanalysis. We don't have enough Black patients. We don't have enough Black, all of those things she's carrying. And she says, of having to split off parts of myself and my identity to minimize white discomfort. What is she talking about, people? What's she saying here? Yes.
Using her identity to be whiteness, to be part of the problem.
Yeah, but you're right. But she says something else. Yes.
Not wanting to rock the boat?
Not wanting to rock, but why not rock the boat? It's the why. She's telling us why. What is she afraid of? She tells us. Go ahead. You're looking at me? It's a bit. Tell me.
To be labeled as complicated.
Mm-hmm. You label as complicated. En plus, what else? This is something people don't like talking about.
One person on Zoom is saying, we are taught to be polite. Calling out uncomfortable experiences makes white people uncomfortable.
Yeah. Whiteness doesn't like to be challenged. Because whiteness has been told this is the way things are. Not talking about white people. Talking about the water. Talking about whiteness. And so we've been taught, gay people have been taught, don't make the straight people upset. You know, pretend. Anybody ever seen the Birdcage with Robin Williams? And you remember that scene when he's teaching his partner how to walk, how to eat, because the parents are coming over. Yeah, and he said, put your finger down, and don't walk like this. Hold it tight. Walk. That's exactly what we're talking about. Because we've been taught, people who live in that vulnerable state have been taught, not whoever it is, not to make the other feel uncomfortable. We see it in old age homes, people will say, oh, don't tell them that, your grandmother, like as my grandmother did, oh, I'm being hit by the orderly, don't say anything because you're not here to protect me, man, I'm not here. So I pretend that I don't have pain, I don't want to ask for the pill, because people do this all the time because they've been taught not to make the people who are abusing them experience discomfort. Yes, go ahead.
One person is commenting code shifting to fit our environment.
Doing what?
Code shifting.
Yes, yes, we do. So here's the takeaway. If you really want to know how justice is administered in the country, don't ask the policeman, don't ask the lawyer, don't ask the judge, don't ask any of these people. Go to the unprotected, those who need the protection, and listen to what they're telling you. But we don't do that. We ask the people who create the policies, how's it going? We don't ask the patient who's in the emergency room and who's been sitting there for 8 hours, how's it's going. We go to the doctor, we go to the nurse, we go to the administrator. But we don't ask them, what does it feel like to be sitting here for 8 hours and you haven't been seen? So we just talk about how we're short-staffed, but we don't talk about what is going on with that person. What does it feel like? So if you want to know something, go to the people who are going through the issue, not the people who are implanting it. So we in healthcare, we are not outside of the system. We contribute to its problems, but we also have the power to contribute to its solutions. We can deconstruct, we can transfigure, we can do what we can create, but we have to talk to the people who are affected. We can't assume that we know everything. We can't assume, oh, but Black people are this, so this is how we're going to do it. Talk to them. They won't bite you. Once you realize that we're all swimming in the same nasty water, they won't bite you. But if we continue to think that they're over here and we're over here and that one's over there, yeah, then we're going to run into trouble. People's places within the system determine how they're seen, how they see others and how they're treated. When we go into a room, when we look at people, we bring all our prejudice in with us. We bring all our goodnesses. We bring all our badness. We bring what's nice. We bring what's hard. We bring it in and we go down the street. Take a look at your neighbor again, please. Take a look at your neighbor. Just turn and look at your neighbor. You go down the street, that person walks into your room. They need your help. You just look at them. You immediately have an opinion. And it doesn't have to be based on fact. It's based on your stereotypes. It's based on the water you've been swimming in. And you bring that in and you think they don't know, but they do, because you see, we exude it. We exude it. I did an experiment with one of my classes once. I walked, they knew me. I walked in, I dressed like this, how I dress, they're fine. But this particular day, I walked in, I had bags, kind of a crocus bag over my head and had some tattered clothes and that kind of stuff. And I got somebody to put some black paint on one of my teeth, and I came shuffling into the room. They didn't know it was me. And I just came in and, it was like, and you could see the fear on their faces. And I came in and I said, oh, I'm looking for Dr. Lashley. I'm Dr. Lashley's sister. And you thought, there was this absolute horror. And then I took all the stuff off, and there was this sense of safety. And I said, why did you react that way? I mean, we deconstructed that, what was going on. So you go into your waiting room or what have you, and you see this person, you bring yourself into that room. We all take ourselves into that room, but we have to be aware of it. Sorry, it didn't turn off my phone. I'm just going to turn it off and turn it down. Sorry, it's my daughter. I'm sorry. Renata, are you okay? Okay, because I'm still in the meeting. I don't know, darling. I'm calling back. Okay, oh no, you didn't. Sorry, I always take my daughter's calls. I'm sorry. Let me turn this off. I think, especially on Saturday night, I got a phone call that she'd been rushed to the hospital with an allergic reaction. And so she hasn't been feeling that well ever since. She's fine now, but so I apologize. But nothing comes before my kids, so too bad. So we take ourselves into the room and we use our position and our privilege. We can use that to be allies and to advocate for others. We can start talking about the water. You will not get people to change if you talk about them, because all that happens is people become defensive. You need to talk about the system. It's the system that needs changing. When we teach medicine, when we teach anything, we only teach what we've been taught. And for the longest time, people taught that Black people didn't feel pain. And so and it still happens to some extent, there's still some people who believe that. Do you know that more Black women die in childbirth than any other group? Because they don't get the medication. When they say they're in pain, people don't believe them. They don't get the help they need. I mean, there are all kinds of things that happen. So we've got to use our position to become allies. When Cheryl talked to you earlier, she talked about resilience. Resilience, we can't keep saying to people, oh, you can take it. They're so resilient, no matter what you do to them. They just smile, those happy little Negroes. They just sing and clap and dance. They're such happy little creatures, those indigenous, well, call them indigenous people, when you're doing this, them Indians, they're really savages. But boy, can they be, did you ever see the beadwork they do? They're such good beaters, those little savages. I meant the Indians, I meant, what do we call them now? Indigenous? Yeah, them guys. That's what we do. So resilience is a function of, they're not being resilient. What we're doing is teaching people to cope with bad behavior. Resilience occurs when you've got a coterie around you that supports you, that stands up for you, that tells you, I understand, that's there, that you can turn to, that allows you to cry, that allows you to laugh, that's there for you. And you know what? I really don't care if you support me when I'm in the room, but I do care if you support me when I'm not in the room. I really do care. What do we do when that person's not in the room? Do we just say, well, they're not here now, so yeah, you can say that. Because you see, not saying something is also saying a lot. So resilience is a function of the environment in which we find ourselves. Do we feel supported, or are we just teaching people how to cope? So let's look at the different types of resilience. In imposed resilience, we say you can take anything. You're strong. You're strong. You can put up with it. Whatever I throw at you, you're strong. You know how to take a joke. How about this one? Can I touch your hair for good luck? You cute little monkey, you. And that's a combination of internal strength and external support. But it's imposed resilience. It's not real resilience. And it calls for a lot of internal strength, usually not to pop somebody one. Who else do we go up to and say, can we touch your hair? I don't know any other group that has to deal with people coming up and say, can I touch it? Sometimes they don't even ask to touch it, just touch it. Do not touch Black people's hair. Don't do it. And for goodness sake, do not do it without their permission. We have mental resilience, which is really a type of stress reduction. And that comes, as I said, resilience is a combination of internal strength and external support. Mental resilience, you have that internal strength, you can deal with stress, you can reduce the stress, but you also have this external support. Impose is that thing up there where they say you can. Now we're looking at the real types of resilience, and it's a combination of internal strength and external support. In emotional resilience, we are emotionally flexible. We can adjust. We can't do that unless we have the external support, because we're going to be uptight all the time. So again, internal strength and external support. In spiritual resistance, we use our sense of spirituality. Where do we get this strength from? What's our belief system? It's got nothing to do with religion, but it's the sense of meaning. How do we bring meaning to things in our life? That's spiritual resistance. And physical resistance is your health, physical health. Am I strong enough? Can I lift that pail of water? All of these things combined make up resilience. But the cost of imposed resilience is destruction, because you have neither the internal strength nor the external support. You have what?
15 minutes.
Okay, so all right. So let me take you, let me see. Now, I want you to know that Black people come in all shapes and sizes, but they also come in all colors, in all hues. And a lot of the people you think are white are not. That's really, really important for you to know. And the importance about this is there was a time when people used to pass. If you were very, very light, people passed. And very often, women had hysterectomies, so that if they married a white man, because the ideal was to marry a white man so you could get into that water, and they were afraid that if when they gave birth, their children would show blackness, would have some black tinge to them. And so they often would have hysterectomies so that they couldn't get pregnant. And parents, especially mothers, would pretend to be their daughters' maids so that they could be near their daughters and work for them. If any of you have ever read Edna Ferber's Imitation of Life or seen the movie Imitation of Life, you'll see that played out very well there. So I want to tell you some of the problems. I want to get through this for you quickly. Now, sensors, and these are really important. Sensors, you know, when you go to wash your water, you go to wash your hand, or you go to the hospital and they put a pulse oximeter on you, or you're running with your watch or any of those things. Well, these are based on algorithms, but the algorithms are set by whiteness. You know, you know how hard it was to get an emoji that wasn't white, just to put your hand up in a meeting. They're systemic and they're repeatable harmful tendencies in computerized models that result in unfair outcomes. I'm going to leave you the slides. Unfair outcomes in terms of race, gender, and so forth. Now, a 2021 study showed multiple forms of the bias, including historical, representation, and measurement bias. Now, this is important. Now, the facial recognition, I'm going to come back. The facial recognition here, this has gotten a lot, the police, this has gotten a lot of people in trouble because the facial recognition technology sets up, so it assumes that the Black person is the culprit. And so the police, when they use the FRTs, they're making mistakes because that's what's being given to them. Back to water. The technology is bad. People are working on it now, but this was a 2026 study. This 2026. There's a lot of work going on to try to fix that. The chat boxes are meant, they set up to depict Black figures as racially hostile and historically incorrect. About Black history, they favor white supremacists. We know this. This has been known for a while. The work is ongoing, but there's still a lot more work to do. So here, this is what I want you to look at. Right. They are also unsafe. A lot of the cars, especially the self-driving cars, because the technology is based on whiteness, they often do not recognize the darker skins crossing behind or in front of the car. People have been hit because the technology didn't recognize that the person passing behind was a Black-skinned person. And so and it increases, therefore, the security risk when you're in a self-driving car. Even in your own, that's why you always have to be careful because the technology, you hear the beep, 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 beep. You say, but I don't see any. The sensors are set up based on whiteness. Wearable devices are also a problem. There's increasing evidence that the devices, they're not accurate and may not work at all with darker skins. So when you're getting things and you're sending your heart rate, for example, it's supposed to track your heart rate, but if you're sending that data back to your doctor, your doctor may be getting incorrect data because it's based on whiteness and the heart rate is a little bit different. When you do the pulse oximetry, you do PFTs, pulmonary function test, a lot of it has to do with the torso. But if it's based on whiteness, the data they're getting is incorrect. The faucets. Anybody ever go to try to wash your hands? But the faucets were set upon whiteness. So when the data shows that the darker the skin type, the longer the water took to come out. So you'd see people there trying to wash their hands, doing this. My daughter said to me, my daughter who's mixed is always saying, I'm trying to find the whitest part of my hand so I can wash my hand. One of the things, Costco, how am I doing for time? Tell me. 8 minutes, okay. At Costco, for the longest time, we used to go to Costco and ask them to please change the background taking the pictures. And they wouldn't change it. They say, oh no, it's set up there, it's perfect. So you know what, how we got them to change it? We bought, a whole bunch of us bought one card. And all you ever saw on the card was a blob, so you couldn't tell who it was. So we called it the universal black card. I bet anybody